Hello everyone, a very good afternoon. Welcome to today's webinar, IQ, Smart Habit for Sharp Vision. I'm Ritu, your host for today's session. I'm thrilled to have you all with us. It's great to see many of you interested in learning how to take care of your eyes and maintain healthy vision. In this session, we'll explore practical tips and smart habits to help you keep your eye sharp for years to come. So now I am pleased to introduce our speaker, Dr. C. Jagdish Reddy, MD of Pristine Eye Hospital. Dr. Reddy specializes in cornea, cataract, and refractive surgery. He completed his MBBS and MS with fellowships at Wills Eye Institute and LV Prasad Eye Institute. He also served as the head of cataract and refractive surgery at LV Prasad Eye Institute and an adjunct assistant professor at the University of Rochester, USA. So we are excited to have you, sir, Dr. Reddy, sir, here today to share his expert insights and how to keep your vision sharp. So, Dr. Reddy, over to you session.
Yeah, thank you, Ritu, for that wonderful introduction. And thanks, Shrikant and team from Ethica for facilitating this meeting. So hope you can see my slides. Ritu, can you please confirm if you can see my slides?
Yes, we can see your slides.
Okay, thank you. Okay, today we'll be talking about some habits that we could improve during our working hours so that you can protect your eye. There's some facts which you wouldn't have heard earlier, but I think this would be a good learning for you to make sure you do not develop some changes in the eye, which could be irreversible over a period of time. Okay, I'm sorry, I'm not able to move the slide. Yeah. 1 second. Yeah. So this is how the presentation is going to be. We're going to discuss about this presentation has been built based on what this age group of patients who present to my clinic usually come for. So one of the most common thing has been symptoms of dry eye or computer vision syndrome. And the second question they ask is, do I need to wear blue light filtering glasses? And their positioning during working hours, like how they position themselves, and what is the best method of to get rid of their glasses or contact lenses. So we will divide these into multiple slides, and then we'll have a Q&A session where I'll be able to clarify if you have any doubts. Before that, I would like to tell about myself. Like, I'm Dr. C. Jagdish Reddy. I am the founder and managing director of Pristine Eye Hospitals, which is right across Raheja Mindspace. And we do have, this is a facility, pictures showing the facility, very spacious and very comfortable. And we have the most advanced diagnostics facility as of today in different fields, coming from laser vision correction to dry eye diagnosis, cataract, laser surgery, retinal surgeries as well. And then we do have very robust dry eye launch, providing treatment for all types of dry eye from mild to severe. And we do have refractive surgery suite where we do provide laser procedures for cataract, and all sorts of laser procedures are done to remove spectacles at Pristine Eye Hospitals. And this is a the operating room facility with the most advanced equipment, providing the best care possible in the city. So if you look at what is the burden of an eye disease, like the millions of people across have different eye diseases, and many of them get affected over a period of time. This is majorly based on age or their lifestyle. So dry eye has been one of the most common disease that has been increasing in the recent times. And this is the sad part is this affects a lot of individuals who are at very productive age group or at an younger age group. So I think as of today, if you look at more than 2 crore Indians must be suffering with dry eye, and especially those who have been on screens for quite some time are the ones who would be affected. Before going in detail about dry eye, let's look at a little bit about anatomy of the eye so that you understand all the aspects which I'm going to talk. So if you look at your eye, you can look at the opposite person where you can see an eyelids that blink over the eye. And then you have the black part of the eye that's called cornea. And the central round thing is called the pupil. And the white part is called the sclera. So when you look at the section from the side angle, this is how it looks like. The cornea is the front dome of the eye, and then you have the iris, that's the brown part of the eye, and then the lens that develops cataract with age. And then you have the retina, that's the back part of the eye, or it's the that is called the nerve of the eye. And then you have the eyelids, which are covered by a layer called conjunctiva. And then you have some glands in the eyelids, which are very important for us today. So the first topic that we would like to discuss is called computer vision syndrome. And this is seen in a lot of individuals who spend time on screens. Okay, how is it defined? It's a group of eye diseases and vision-related problems that results from prolonged use of any of the screens, including the cell phones. Okay, and what does it cause? It causes dry eyes, it causes eye strain, it causes headaches, it causes fluctuating vision or blurry vision. It also causes neck and shoulder pain because of chronic use of the screens and abnormal posture. So why does it happen? This is because of less or incomplete blinking, poor lighting conditions where you're sitting, glare on the digital screens, improper viewing distances where you're sitting, poor seating posture, uncorrected vision problems, and a combination of all these can lead to overall a disease called computer vision syndrome. So people present with different, one of the common thing that people present with is dryness. And this dryness can be perceived by each individual differently. It can range from dryness, grittiness, burning sensation, and to soreness, scratchy, itchy sensation, sensitivity to bright light, puffy eyelids on waking up, inability to see any of the screens for longer hours, and they feel comfortable by closing their eyes. So people present with different symptoms to the clinic. And what is dry eye? Dry eye in general, it's a multifactorial disease. A lot of factors can cause dry eye. This is because of inadequate or poor lubrication of the eye. So when you blink, there's lubrication that happens in the eye. If this is lubrication is poor, that's when people develop these symptoms, and this is called dry eye. So it could be produced because of less manufacturing or less production of tears, or poor quality that is leading to evaporation of the tears. There are two causes. One is less production, and the other one is quicker evaporation of the tears. So the first one is called aqueous deficiency dry eye or type 1 dry eye, which is seen in less number of people. The second one is called evaporative dry eye, and that is seen in 80 to 85% of individuals across the globe. Okay, this poor tears can lead to redness in the eye. This is called inflammation that in turn leads to damage to the eye surface that will keep bothering you on a long run. So what exactly happens when we blink? So whenever we blink, we think there's a bunch of water in the eyes, but it's not true. Tears are made of different molecules. They form three distinct layers when you blink. They're produced from different parts. The inner layer helps in sticking of the tears to the eyes. Second layer, the blue color one, is water. It forms the bulk of the tears. 80% of the tears is water. And the most important thing is the lipid. There's a top layer. It prevents evaporation of the watery layer and hence provides good quality to your tears. So this is how the glands, this is the different glands that produce the tears. The tear gland is the lacrimal gland that is under the lid that produces water. And the lipid glands are called meibomian glands. These are the ones which produce oil. That is very important. These are the ones which get affected in more commonly, especially when you see screens. So the bulk, the tear gland, when doesn't produce water, it leads to decrease in the bulk and the quantity of the tears, whereas the quality is affected when the lipid glands are damaged or if they don't work. So there are a lot of risk factors where we will not go through them now, but computer use is one of the most common thing that we see in the recent times. So what do we do when someone presents with symptoms of dryness? We have a detailed history that we take when they come to the clinic, and then based on that, we assess the risk factors, and then we do some diagnostic tests in the clinic to identify the severity and the type of dry eye. As I was talking about, there are two types of dry eyes. One is called quantity problem, one is called quality problem. So when we look at this two, the aqueous deficiency dry eye is because of the quantity, and evaporative dry eye is because of the quality. And then based on the numbers that we get, based on the tests that we do, we categorize them into mild, moderate, and severe, and treatments are different for each set of condition. So aqueous deficiency dry eye is leading to lack of volumes, and evaporative dry eye leads to a more evaporation of the tears. So if you're here, the most common disease, as I told, it's evaporative dry eye. I thought I'll discuss that first with you. So these are the glands. If you can see on the right, you have a picture of the glands, which are seen by a normal picture from the photograph. You can see the glands which are present in the eyelids, which are not visible. You can see these glands are blocked, and you can see white spots on them. They have oily glands, which when the oil comes out, it gets blocked, and they have caps like this. At the bottom, we have the imaging system. That's a scan that we do in the clinic, where we can see the status of the glands in the eyelids. Most of the glands are healthy, but in the center, you can see 2 to 3 glands are damaged, and this damage is irreversible. Okay, Meibomian gland disease is a very chronic disease. It's not acute. You may have symptoms for a week or 10 days, but the disease must be happening for quite some time for you to have symptoms in the recent times. This is because of the obstruction of those glands which are present in the eyelid, and they don't produce oil. So how do they produce oil is whenever you blink, these glands which are present in the eyelids, they are squeezed and they're stimulated, and they produce oil that forms a uniform layer on the watery part of the tears, and they prevent evaporation of the tears. Just imagine if you put a glass of water in the sun, the water evaporates very fast. Just put few drops of oil in the water and put it in the sun. Now it takes longer time to evaporate. The same concept applies here. The presence of oil prevents evaporation of the tears. If you don't have this oil in your tears, the tears are going to evaporate very fast. So whenever you see the screens and you don't blink properly, or if you blink incompletely, where you're in a hurry to blink and then you do a partial blink where these glands don't work, this leads to tear film instability, that leads to excessive evaporation. When there's more water that evaporates, the tears become hyperosmolar, that is, they become more concentrated in the eye. When they're more concentrated, they irritate the surface, that's called inflammation, that leads to damage to the surface, that leads to irreversible loss of the cells. And that's a cycle that keeps happening, and it's very important for us to break this cycle by identifying at a very early stage. There is enough amount of literature showing that people who see screens have less blink rate compared to those who do not see screens. And there's also enough literature saying that incomplete blinks are also risky, where these incomplete blinks are not as efficient as a complete and a wholehearted blink. This is what is called incomplete blink. You're blinking, but you can see that lid is not closing. Two lids are not opposing. That means that blink is not complete. These incomplete blinks are also a reason for development of this disease. Okay, so we do, based on these studies, it's clear that there is, with the screens or when you read for longer hours, there's definitely a decrease in the blink rate, and there's also more number of people having incomplete blinks. Both these can have a long-term impact. But it is also shown that bigger screens do have less impact on the blink rates. And there are two age groups that are affected by this disease. One age group is screen users or screen addicts, where there's lower blink rate. And the other group is an elderly age group for 60 plus years, where they have less efficient blink rate because of the poor muscles in the lids. So both these age groups has been affected. Earlier, the disease was in the elderly age group. With advent of IT, with the with this professional need for computer usage, it's been seen that disease has moved completely in a majority of the people to the younger age group. Earlier, it was this disease is seen at least in 60 to 80% of individuals, and earlier the disease was more in elderly people, and now we see it in younger patients. So the symptoms are the same symptoms that I explained before. So this is how it would look like. People can present with any of these symptoms. And this is how we look at the clinic with high magnification devices. We see that lid margins have a lot of changes because of the disease happening for quite some time. So this is what happens over a period of time. There are abnormalities in the lipid layer in the tears. There are dropouts of the glands. There are changes in the lids that we need to address over a period of time. So at the clinic, we look at the clinic examination, high magnification. We do assessment of these glands, and whenever we are suspicious, we do a complete dry eye test. So dry eye test involves measuring the quality of tears, measuring the quantity of tears, looking at the type of blink you are having, and also looking at the tear glands, what is the status. And in people who have disease for a long time, we have certain changes in the eyes where the blood vessels come in. They cause chronic or irreversible changes at the lid margin that can bother for a very long time. So what happens if you don't blink regularly? The oil that is present in the tears becomes thicker. It becomes paste and it doesn't come out. So for us to get it out, we have to put pressure. You can see a paste-like material coming out, and this is not helpful when you blink. So your tears will have only water, and then you start feeling heavy, pricky sensation. So based on the quality of the oil that comes out, we grade them into different categories. And this paste can be very thick, and that may take a lot effort for us to pull this out. This is called meibomian gland expression. At times when we are not able to we're not able to get it out easily, this is what we resort to over a period of time. This is the test which I was talking about, dry eye assessment. This is an imaging test that we do at the clinic whenever we suspect this disease. These are the normal glands which are present in the eye on the screen to your left. And when they are blocked and they don't work for a longer time, they are atrophied or they killed over a period of time. The disease that you see on the right side, the glands have become short and some of the glands have been completely removed. The changes in the lids that we see are irreversible. We will not be able to restore these glands at this point of time with any management strategy across the globe. Now, the treatments that are done from us are trying to identify this disease early, trying to prevent further damage. So this is a dry eye test that we do at the clinic. This is called meibography or dry eye assessment test. It measures the tear film dynamics. And what we do is we measure the quantity of tears. It's called tear meniscus height, and it gives us quantification of the bottom with a graph. And we measure the quality of tears. How do we measure the quality? It's called tear breakup time. So non-invasive tear film breakup time. Whenever we blink, tears are spread on the eyes. We're measuring how many seconds these tears would be stable on the eyes. So before we blink again, the tears would dry out in between. We're measuring these in seconds. The longer they stay beyond 15 seconds, it's considered normal. Anything below 15 seconds, we consider it as abnormal or poor quality of tears. So that's how we identify and we treat. And the quality of tears is dictated by these glands, which are present in the eyelids. We can see here the lot of glands in the upper lids, but if you can see in the lower lid, majority of the glands have been damaged in this patient. And then we do have a grading system based on the loss of glands. We do grade them into mild to severe, and then we do treatment strategies accordingly. So let's look at, this is a 43-year-old very senior IT employee in one of the multinational companies. And she just presented to us with a pricky sensation just a couple of weeks ago. And her tear quantity was good at this point of time, and there was no suspicion of the dry eye. But clinically examining her, I was suspicious, so we got this test done. So the quantity of tears was normal. That's well and good. And then we looked at the quality. The quality of tears also was good. That's why the patient was not symptomatic all this while, and she was symptomatic just 2 weeks, from 2 weeks only. And this is the status of the glands. Can you imagine that about 85 to 90% of the glands have been atrophied or killed, and there are only 10 to 15% of the glands still viable? So why was she not symptomatic? There are two reasons. Her work, depending on her work, if the work has not been that, being in a senior management position, if she's not in doing that strenuous work on the screen for longer number of hours, probably that is one reason. Second reason is, as a doctor, I would anticipate the glands which are still present are working very efficiently, so she's not having any symptoms at this point of time. But as these symptoms increase, she would, as the functioning of these glands would get decreased, her symptoms could further increase, and this will lead to her becoming more sensitive to light, change in humidity, change in temperature, and inability to see screens for longer hours. So we do give based on severity. We give medications for the eyes. We do have tablets, and we have some procedures that we do based on the severity of the disease. So this is called intense pulse light therapy that we do in the clinic. This is a daycare procedure, just a 5-minute procedure we do for advanced disease, and only a couple of centers in the city do this intense pulse light therapy, and it's very efficient. A lot of people are symptom free with this therapy. And this is one more patient who benefited with this therapy. He's 28-year-old IT professional. He presented to us with symptoms of dryness, and then his tear quantity was less in both the eyes. And if you look at tear quality was less in both the eyes, his tears was drying out as early as 5 seconds. And this is the status of his dry eye glands, the meibomian glands. At least 60% of the glands have been damaged in both the lids. And then we did this therapy over a period of time. We did see that his tear quality of tears improved in the left eye from 4 to 15 or 18 seconds, in the right eye from 5 to about 13 to 13 seconds over a period of 3 months. So this is how they would improve with this therapy. And this is one more thing people present with. This is called blepharitis. It's an infection to the eyelids. This infection occurs where the tear glands are opening. So any of these infection persistent for longer time, this can lead to a dryness in the eye. So we do this procedure here, wherein we try to cure the dry eye at one sitting, the infection at one sitting, so that it doesn't prolong the infection and lead to dry eye on a long run. So one example of this is a 28-year-old IT professional who was working, he was from one of the neighboring towns, and then he was working in Canada. He's been having severe sensitivity to light since a few months, but he couldn't get proper care there. And hence, when he came for his vacation, he came to us for a checkup. And then this is what we looked at. His tear quantity was less, and his quality was very poor in both the eyes. And this is the status of his glands. I would say 95% of the glands are gone. He had this changes in the eyelid infection that he had, which was not treated. We had to treat the eye infection for him first, and then we gave treatment for this dry eye disease. He's symptom free, but at this point of time, but he can go through ups and downs as time passes. So we do eye screenings for dry eye disease in a lot of IT companies when the company is interested in to look at this. So we've seen 35 to 40% of the individuals have symptoms of dry eye, and they've not been taken care. So we usually go there and do this dry eye assessment test as well. To dear friends, I would say this disease is rampant, and it's very important for you to be very careful and make sure that when you're sitting at your screens, you take breaks and blink. That is the simplest thing that you could do. How do you blink? We say that every 20 minutes, take a break for 20 seconds to look at 20 feet distance. It's called 20-20-20 rule. When you look at far, you tend to blink. But when you look at screens closer to you, you tend to stare and then you blink less. That's when you get into trouble. So I think it's very important for you to do the simple exercise, and that will help you a lot. So this disease is underdiagnosed. It is present in majority of individuals around, and it's whenever you have symptoms, it's important to consult a dry eye clinic and get appropriate treatment. Taking breaks from screen is very important. Do not decrease your screen time. I do not suggest that, because for your profession it is required. Just take breaks. You give that little amount of time for your eyes, that where you blink, that would take care of things. So we have an app developed for Pristine Eye hospitals. We do have a lot of information in this, in the form of videos or text that is written by me. And then we do have screen reminders. For example, if you're working for 9 to 6 for 6 days, you can just put in that part into the app, and then the app will remind you to take these breaks, so that you can protect your eyes from further damage and development of dry eyes. So this is about dry eye. This was important, so that I took more time to explain more in detail. So next question that people ask is role of blue light in eyewear. So I would say that this is one of the important thing as well that you should be knowing, because you do spend a lot of time on screens. So there's light everywhere, and this light has different wavelength, and some of the wavelengths are helpful, some of the wavelengths of light not helpful. There are certain wavelengths of blue light that are harmful on a long run. You may not have any symptoms now, but because of your exposure to this now, when you grow old, you may develop certain changes. So these are called development of cataract, because of the natural lens in the eye being affected chronically with this light. And second thing is development of a condition called age-related macular degeneration in the retina when you grow old, because your retina has been exposed to these rays over a period of time. Okay, that's called those are harmful blue lights that can be filtered. So there's a significant increase in cataract and AMD population over the years. And I do not blame only the light. There are several other factors, but light is one of the cause. So it is important for you to remember, not all blue light should be filtered. There's good blue light at a certain wavelengths that is needed for the eye, and there's a harmful blue light, and some of the glasses do have this ability to filter. So considering using them when you are exposed to certain certain lighting conditions is important. So to prevent any damage to the retina or the lens over a period of time. So here, if you look at everybody today, we are exposed to different sort of lightings, a lot of new lights coming in, LEDs, everything is not, the safety of these have not been established. We do not look at these when you're buying these, but I think it's important for you to be sensitive about this and be careful so that you can protect your eyes. So blue light is everywhere, trying to protect now from blue light as much as possible, which are harmful, is important on a long run. So some wavelengths are harmful, so it's very important to protect, and there's special lenses which can protect you from these damage, and they do not compromise any way with your quality of vision or contrast that is present on the screens. Okay, so that was one of the aspect of eye care that you could do to protect your eyes. Screen positioning is important. Okay, you do not give that. A lot of us do not give importance of this because we are so much carried away with work, and we just keep doing things, and then we don't give importance until something bothers us. So there are 5 factors of a smart ergonomics, like your chair style and height is important, your desk and its height is important, you monitor your mouse placement and your keyboard location. All these are very important. So it's important. This is some of the pictures that you can see. These are from the internet, so you can look at these. Like, it is very important for you to have everything at your eye level, so that you don't bend your neck or lift your head to do that, and you don't bend, because that has a lot of impact on your spinal cord, and that can lead to a lot of long-term issues. So whether you are sitting, whether you are standing, irrespective of that, you should be able to adjust your heights accordingly. So this is a simple video. This is from Instagram. I thought it was very useful. I put it here, so I think you could go through this. So when you are looking at a screen at a height of your eyes, how much impact of your head on your spinal cord. And when you bend and see what happens, just go through this video. So when you're looking straight, the impact is very less. As you keep bending, okay, the impact of your head on your spinal cord is huge. I can see how the weight increases. And on a long run, this affects your spinal cord and your nerves will keep bothering you for life. So I think it's very important from day one, fix things and make sure you are protected from all these things. So these are the few things that you could take care at your clinic, at your office, so that you can protect your eyes and in general the body from going through these effects. Okay, so next part is few slides about what are this is a very common question. People who have glasses, they come to me asking like, what is the best way I can get rid of these spectacles? So I thought I'll take you through so that you are aware of this. So over the years, the laser surgery has evolved so much. So we have many procedures. The success rate has been different. As of today, we have very predictable procedures. We're giving you good quality and quantity vision and also very quick recovery. People are not looking at just normal 20/20 vision. We are able to provide better quality of vision, and we are able to provide vision beyond 20/20 with certain advanced technologies. So there are different procedures, and these procedures can be customized or tailored to based on the amount of power you have and based on the measurements that we do on the cornea. And these procedures are vary. So over a period of time, from my previous practice, we've been doing thousands of laser surgeries, and over a period of time, we've seen the trend has been changing with time. One of the most crucial thing before proceeding with the laser surgery is evaluating your eyes with the best technology available. So even the minutest change in your eyes can be picked up that can help us customize the treatment in such a way that these changes can be protective for you for life. Anything that is missed with subnormal diagnostic devices can lead to problem with the procedure and can lead to some issues on a long run. So for example, we do measurements on the cornea to pick some values, and these values are used for the planning the surgery. There are some devices that measure only the front surface of your cornea. There are some advanced devices that measure back part of your cornea as well. If there are subtle changes in the back part which we miss, this can lead to weakening of your cornea 2 years, 5 years, 10 years down the lane after the laser procedure is done. It's because some laser procedures can weaken your cornea. And when you have these changes, if these changes develop over a period of time, you end up into new problems. So it's very important for us to do the screening at the most advanced diagnostic devices. At Pristine Eye Hospitals, we have something called Pentacam AXL Wave. It measures both the corneal parameters, the most detailed. This is the most latest scan. And in South India, there are only two, one in Hyderabad with us and one in Bangalore. And the second thing is it also measures your quality of vision, where we look at what it is before surgery and how it is post-surgery, and we can have a track of change of it. And the second one is called Topolizer, where we do the most advanced treatment called Contura Vision. Contura is trying to correct your irregularities on your cornea, that's the black part of your eye, in such a way that your quality of vision is improved and you can get vision better than 20/20. And this device does the work of 5 devices that we usually have in the clinic. And in a span of 2 minutes, it gives us the measurements that are useful in a huge way that we can customize your treatment. And this is what I was saying, that we are the only ones having this device. And the different procedures that we do, I thought I'll just take you through them so that you understand. The first one is called photorefractive keratectomy or epicontura. What we do is we remove the top layer of the cornea. This here I'm showing a manual way of removing it, but we don't do this anymore. We remove this layer also with a laser. So we remove the top layer of the cornea, and then we do a second laser to correct the power. Okay, the laser pulses are customized based on your measurements, and then we place a contact lens for 3 days. You have 90% of the vision immediately, and 10% improves over a period of time, and majority of individuals are happy by end of 1 week and they get back to full potential work. And this lens that is put is removed in 3 days' time. This is called photorefractive keratectomy. This is done in certain group of people. And the second one is called LASIK. And we do a Contura LASIK here. And we at Prestina Hospitals move out of blade procedure. This is completely bladeless. We use two lasers, two big laser machines, where the first laser machines delivers laser to make a flap in your cornea. It takes about 20 seconds to deliver laser, and you'll be looking at light. So the laser machine holds your eye so that your eye doesn't move for 20 seconds. It doesn't hurt you at all. It's painless, it's bloodless, and a quick recovery. And then once the flap is made, we'll lift this flap, and then we do a second laser. This is a Contura laser that is customized for your eye to correct all your power and also make the cornea more regular. And then the flap is repositioned. Here, the procedure is finished in 15 minutes, and then you may have discomfort for a couple of hours after the surgery. At the end of the day, you would see pretty well, and the day one, that is the next day, would be even better. And this is what I was talking about. In traditional methods, we deliver the laser on the cornea just like that. But with this Contura or topo-guided treatment, 22,000 unique points in your cornea are measured. All these points are sent to the laser machine, and laser machine customizes the algorithm for each eye separately. And that's how we can improve each eye in a better format. It's not like one fits for all. So it's like each eye is different. So this is the FDA trial that was done to give permission for the use of this laser. And in this trial, it was shown that at least 6.6 is a normal vision that we see in a lot of people after the laser procedure. But 6.5 or 6.4, this is beyond normal vision that we've seen. At least 64% of individuals were seeing 6.5 or better in this study. This is called Contura vision, and they labeled it as supervision. And the other procedure that we have is SMILE. This is called small incision lenticule extraction, where the laser goes into the eye and fashions small lenticules in your cornea. And then using a small opening, we pull this off. This is one of the technique that corrects the power as well. Okay, we use a small opening of 2 to 2.5 millimeters, and then we just pull this lenticule out, and then your power is corrected. And then for people who are not suitable for laser, we have additional procedures that we can do. This is called ICL. I'm sorry if this video is not it's playing. So what we do is we place a lens in the eye. This is called phakic-IOL or ICL. We make small openings in the eye as small as 2 millimeters, and then we take a lens, a permanent contact lens, and we inject it into the eye, and it goes into the eye and opens up, and that corrects all the power that your eye has. So this is one of the technique that we do. This is called phakic-IOL or ICL. So as of today, laser vision correction is very safe, precise, and predictable. Detailed preoperative screening is one of the most important things, and discussing with your doctor to see what suits you best. There's no best procedure here. Trust me, there's no best procedure. Each procedure has its pros and cons, but what suits you best is the best procedure for you. So it's currently the procedures are highly customizable, especially the Contura vision, and spectacle independence definitely provides you improved quality of life. Okay, and we've been doing a lot of screenings across, especially for the dry eyes. We've not been doing just torchlight examinations. We've gone beyond that. We have a lot of portable devices. We take them and go into complete screening of the eye and come out with all the diagnostics, and then suggest people how to take care of their eyes. So this is how it is. And we also provide teleconsultation services at Prestina Hospital. So anybody has any concerns, we're always available for you. So these are good feedbacks. This is from Hyundai. We did R&D, Hyundai R&D Center, where we did a screening a few months ago, and they were very happy. And they thought eye screening was just doing a spectacle check. But after the way we did, they were blown away, seeing that there's so much that we could do to improve the quality of screenings that we do. So these are all the services that we have at Prestina Hospitals. We're just a call away for you guys. And then we do have complete insurance coverage. And then and we do have interest-free EMIs as well. So this is the contact details for us, and we are available here, and then we will be able to help you out if anybody needs any help. And now I'm open for questions for next 15-20 minutes. I'll be happy to clarify if you have any doubts.
Hi, I'm Sandeep. Hello, doctor.
Hi, Sandeep.
I would like to know any treatment available for rotatory nystagmus.
Rotatory nystagmus.
Yeah.
Yeah, okay. Nystagmus is a condition that develops in certain individuals. It's a congenital thing and usually develops if the vision is subnormal. At this point of time, there's some exercises that are told, but there's no surgical therapy or some treatment that can be done to stop this at this point of time, Sandeep.
Okay, so you said some exercises that can help. So may I know any of those?
So there's an assessment that has to be done for it, and to see what is the severity of that and what is the type of nystagmus. And based on that, a squint specialist can suggest you the type of exercises that can be done to minimize. It's not that it'll go away completely, but it can minimize the amount of changes that are happening.
Okay, so maybe I will take a consultation.
Sure. Thank you so much.
Thank you.
So, is there any possibility like getting into sight again after taking the LASIK treatment?
Yeah, there are few reasons why someone can get some sight after the laser procedure. This is because during pre-operative evaluation, if there's some changes in the cornea that are missed, that can lead to weakening of a cornea over later part of life. That can lead to someone developing power. That is one of the reason. And the other reason is like it's called regression. For example, we correct very high powers, and the body will think there's an injury that has happened, and it'll repopulate some of the cells, and that can lead to someone developing some amount of power. And it's very commonly seen with very high correction. You have 10, 12, or 13 diopters where laser has been used. That can lead to development of this regression. It's very difficult for us to predict who's that 1 or 2% out of the thousands that we do develops this. So whenever there's something happening, based on the situation, we can always go back and correct these. But these are the two common reasons by which someone can develop power again after the procedure.
So, like, is there any point like the person who is having this much of sight will be suggested to go for LASIK, or anybody can do that LASIK?
Yeah, they're not only the power. We look at the corneal parameters with the scans that we do, okay, and also your lifestyle. So these three things, like power, your lifestyle, and the corneal parameters, will decide on which procedure we do. For laser procedure, we don't go beyond 10. We try to stick within the 10 diopters because we have some safety concerns, so which we usually do not deviate, so that on a long run, you do not get into any troubles.
Okay, thank you.
Thank you.
Okay, Saurabh is asking, what is the cost of one-day procedure for dry eyes?
It is difficult for me to say what is the cost of the one-day procedure, because it depends on what type of dry eye you have and what treatment you need. Okay, there are two types of dry eyes which I discussed. One of the type of dry eye we need to evaluate first, and then only some of them are suitable, or only some of them require these treatments. Majority of them, with lifestyle modification, will be able to control the severity of the dry eye. But once we have a baseline assessment to know what is the status, so we can guide you. So based on what procedure is required for you, we can help you out with the additional information.
So we also have a question here from Kamlesh D. It is a bit lengthy, but yeah. Earlier, headlights on cars, trucks, vehicles were yellow, off-white. Since few years, automobile industry have shifted to white headlights, even for two-wheelers. I do feel that yellow ones were lesser harsh on eyes. What's your take on this? Was some study done with the white light for the headlights were better? And as screens are unavoidable, we do have to use our phones, tablets, and laptops. Do you think certain types of screens would put lesser strain on eyes, like Apple Retina display, Super AMOLED display, as compared to LED or LCD displays?
Yeah, that's a very good question. So I may not be able to answer your headlight thing because definitely there's a change in headlight. I did not come across any studies that have been done. The studies are mostly that they look at is what is the visibility range that they would look at when these automobile industries are designing their thing.
Mhm.
What is the effect on the eyes? I'm not sure if anybody has looked at it, but definitely I'll look into this and see if I find something. But definitely there is some benefit with certain screens, guards, or some of the additional features that you have in some of the computers or some of the tabs where you can protect yourself from these harmful rays. Definitely there some research has been done and they've been proven that it protects you to a certain level. So I think definitely these wherever these there is an option that you could use this, I think you can definitely consider using these.
So we've also launched the feedback poll along with Dr. Jagdish's poll. So please do respond for the polls, and meanwhile, sir will answer the questions.
Yes.
Yeah. So there's another question: is LASIK surgery safe? I have found out how the eye pop out during surgery and creates complications. It happened to someone I know.
Okay. So the of all the eye surgeries that we do as of today, I would say laser procedures are most predictable as of today. So we did have a certain amount of complications when we were doing earlier with the use of blades and all. But now when we moved out completely with the most advanced technologies, was completely bladeless, and these have improved the safety. The complication profile of any of these laser procedures is so negligible that we do not have any consequences that could stay permanent. These are very transient that can be fixed, and you could see very clearly in a quicker fashion. So we would consider when we're doing LASIK that we are operating on a normal eye. So we would also be so careful that it has to go normal and it has to see normal immediately after surgery. So that concern will be definitely addressed.
So we have one more question from Malesh. What would be the reason for burning sensation in eyes and how can we prevent it?
Yeah, so this is what we talked about today. That dryness is one of the things because of less blink rate, you tend to develop poor quality of tears that leads to quicker evaporation, and then your eyes dry and then becomes burning, and you want to close your eyes and blink. So it's very important for you. A lot of people will think putting a drop will cure dry eye. It's definitely not that case. Drop will give you symptomatic relief for that point of time, but the disease will keep progressing. So it's very important for you to take breaks and blink and modify your lifestyle in such a way that you give some time for your eyes as well. So that is important. So that way you can prevent long-term problems with the dry eye.
We are having one more question from Abdul. Any fruit good for eye hygiene?
Yeah, I would not label one fruit being good for only the eyes because there are a lot of things. It's a balanced diet that is required. Always look at a balanced diet that is required. But one thing which would help with dryness is the lipid glands would work better, or there will be more synthesis of lipids with omega-3 fatty acids. So either increasing the diets, like you can fish if someone is non-veg, or you can use walnuts or flax seeds. All these can improve the omega-3 fatty acid levels in your body that could help you with your dryness to a certain extent. But it's a balanced diet that is required. I would not put one fruit on the top end saying that this will cure your eyes problems.
Okay. So we are having question from Rajshekar. Is there any common eye drops for daily screen uses? I use my screen for more than 8 hours.
Yes, Rajshekar, there are lubricants, there are a lot of lubricants which are present in the market, and they work on there are different molecules that are present that are used for different types of symptoms. So people use left and right, but I think there are studies behind this that for these type of disease, these drops would work or something like that. But in general, people use like sustained drops or refreshed tears. But I would recommend that do not depend on these drops. Try to identify if you have some problem and try to modify your lifestyle in such a way that your natural tears are sufficient for you to give you necessary health to your eyes rather than these artificial drops. Artificial drops do have some preservatives. On a long run, they can bother you, but I think it's very important to modify your lifestyle in such a way that you improve your natural tears functioning on a regular basis.
Yeah, thank you so much. And one more question we are having from Vasudha. What is the remedy for eye itchiness?
Yes, so Vasudha, like one of the reason for eye itchiness is any allergy can cause eye itchiness. So like you're exposed to something that you're not you're sensitive to, you can have eye itchiness. But eye itchiness is also a symptom of dry eye. As I showed you one of the eyelid gland that you're blocked and you can see white spots on the eyelids. This is the lipid that is present there, and this lipid can lead to colonization of bacteria, and that can lead to eyelid infection. This eyelid infection can lead to itching, and you feel like rubbing your eyes all the time. So if you have itchy sensation that's not coming down, it's important to rule out whether you have allergy or an infection and get it treated appropriately.
Yeah, thank you so much. And we are having question from Shushma. I get headaches these days, and when I look at distance, my vision get little blurry. For some time, my screen time is 7 to 8 hours. Any suggestion to reduce headache and blurriness?
Yeah, Sushma, the two reasons that you could get headaches when you're seeing screens is one is if you have any refractive error, that's power in your glasses that's not being used, that could be one of the reasons. Second is even dry eye can lead to computer vision syndrome. Dry headache is a part of computer vision syndrome because of the screen time, you tend to get tired, exhausted, that can lead to headache. And the fluctuating in the vision is also a symptom of dryness. So I think it's very important if you have these symptoms to get your eye checked, both for power and the dry eye status as well, and get yourself evaluated and treated so that you don't get these symptoms.
So I think that's all for today. So we can end the session. Thank you for joining today IQ Smart Habits for Short Vision webinar. We hope you found the session is valuable. And special thank you to Dr. Reddy sir for sharing their expertise. So thank you so much, sir. And one more thing we want to introduce, we also invite you to join our daily meditation session from morning to Friday to support your well-being. So morning meditation starts from 6:30 a.m. to 7 a.m. and evening meditation starts from 9 p.m. to 9:30 p.m. So I'll just share the link in chat box, or you can also directly join by the Ethica portal. So we appreciate your time and participation. If you have any question or need more information, you can reach out to me. Wishing you all the best in maintaining sharp vision and mindfulness. Doctor, you want to speak something?
Yeah, no, at the outset, I would like to thank all the participants who were part of this program. And then hopefully it was useful for you guys. And I will also thank Ethica for facilitating these wellness program to your teams. Okay, thank you so much.